So I'm Cedric Tremblay. I'm from Quebec. I grew up in a small town where there's a lot of genetic diseases. My family was very much impacted by cancer, cousins, grandma, relatives. I did my PhD, my doctorate in pediatrics in Quebec City, then my first postdoctoral fellowship on T-cell leukemia, which I'm still working on today. I had an 11-year experience in Australia, and I decided to bring back that experience in Manitoba.
Hi, I'm Bert Dregemiller, and I'm an assistant professor in biochemistry and medical genetics, and also a Canada Research Chair in pharmacogenomics and precision medicine.
Well, my name is Sapna Broy. I am a pediatric oncologist at Cancer Care Manitoba, and I'm also a clinician investigator at Paul Brexton Research Institute and at CRIM. I also lead adolescent and young adult oncology program here in the province of Manitoba.
Why Promise? Because I think it was the best opportunity to bring people together to tackle terrible cancers in children and adolescents.
What attracted me to Promise is my lab focuses on looking at why some people get serious adverse drug reactions to treatments. And for cancer treatments, this is particularly important because while some of these treatments are really effective, they also come with severe toxicities, which can be devastating to children who have smaller bodies, and the effects of these toxic effects have lifelong consequences. And so Promise really brings together people with an interest in trying to make better, safer treatments for these children with cancer. And I'm really excited to be a part of this team.
And what attracted me to Promise is its commitment to bring basic scientists, translational researchers, clinicians, and most importantly, patients and their families all together in a platform to drive research excellence in pediatric and young adult oncology.
Supported by CRIM, the Children's Hospital in Manitoba, in collaboration with Cancer Care Manitoba, Promise, or Pediatric Research in Oncology in Manitoba, Innovation, Science, Excellence, is a multidisciplinary research initiative dedicated to improving outcomes for children, adolescents, and young adults living with cancer in Manitoba.
Cancer Care Manitoba is a provincial authority for cancer and blood disorders, leading long-term planning and service delivery across province. In addition to providing comprehensive clinical care and strategic oversight, the Paul Brexton Research Institute at Cancer Care Manitoba contributes significantly to the cancer science in Manitoba as well as around the world. In partnership with CRIM, Cancer Care Manitoba is a key supporter of Promise, thus helping to drive forward the pediatric and young adult oncology research, not only in this province, but also across the world.
Promise's main goal is not to perform research, but to facilitate and support research performed by our members.
Children are not simply small adults. The cancer they develop differs significantly in type, underlying biologies, therapy they respond to, and treatment requirements. All these special needs mean they require dedicated research and specialized models of care to improve their outcomes.
I think trainees are almost some of the most important members of Promise because they are going to be the future of science. So we're really focused on trying to create initiatives that are led by trainees so that they can gain some leadership experience while networking with maybe more senior researchers. We also want to focus on providing some early funds for trainees so that they can kickstart their own careers. I think they're the lifeblood of the team. So we want to make sure we're really including them in every aspect.
In pediatric oncology, research is deeply integrated to clinical care. The improvement in survival outcomes and reduction in the long-term toxicity of childhood cancer treatments has only been possible with the help of research that has been conducted for decades in pediatric oncology. In pediatric oncology, research is clinical care, and improving research will only lead to better clinical outcomes.
Together, we're defining what are the needs and how can we pair researchers with people with lived experience to make sure that we integrate people with lived experience within research to make sure that we actually address the needs of the population we're serving.
We want to engage patients as research partners, not only as research participants.
Yeah, so I think we hope that the research that we're doing is really going to make better treatments, make better decisions for patients. So ultimately, we're hoping that this research or the research generated from interactions established through PROMISE will lead to better treatments and better long-term effects for children and young adults.
Cancer is not fair to anybody. Cancer is a terrible disease. It is the most common non-accident related cause of death in kids and adolescents. Yes, it has a detrimental effect on the patient for their life, but it as well affects the whole family. And so, personally, if I have to take a challenge, that's the one I want to take, because we can put all our effort and it will maximize the impact. And we might have a lasting positive impact on the life of so many people. And so that's the reason why I'm working in pediatric oncology.
I think there's lots of hope for the future, and I think we have many exciting things going on. So I'm really, really excited to be a part of this team.